Remove gloves by turning them inside out. Discard in a leak-proof container or plastic bag. With clean, bare hands, take the package containing the copper T380A and partially peel open the plastic farthest from the IUD arms. Take the white rod, which is the plunger, and slide it inside the inserter tube. Place the IUD package on a flat surface and slide the ID card underneath the arms of the IUD. While the IUD is still in its package, hold the tips of the IUD arms with one hand and push on the inserter tube with your other hand so the IUD arms bend down. When the arms touch the sides of the inserter tube, pull the tube away from the folded arms of the IUD. Elevate the inserter tube. Then push and rotate it to catch the tips of the IUD arms in the tube. Push folded arms into the inserted tube just sufficient to ensure retention. Without directly touching the blue depth gauge, slide it to the measurement of the client's uterus. Align the depth gauge and folded arms of the IUD to the same horizontal plane. Now you may completely open the package. Put on sterile gloves. Remove the loaded inserter tube. Be careful not to touch any unsterile surface. Make sure you do not push the white rod towards the IUD.
Okay, Mrs. Opong. I'm going to insert the IUD. It will slide through the cervix into the uterus. Then I will release the arm so it will stay in place. Please, if you feel any pain, let me know.
In one hand, hold the loaded tube. With your other hand, gently apply traction on the tenaculum. This will help straighten the cervical canal for easier insertion. Now pass the loaded IUD inserter tube through the cervix until the blue depth gauge touches the cervix or you feel slight resistance. Be sure the blue depth gauge is still in the horizontal position. Hold the tenaculum and white rod firmly in place with one hand and release the arms of the IUD by partially withdrawing the inserter tube. Continue to gently pull the inserter tube toward yourself until it touches the circular thumb grip of the white plunger rod. The IUD is now released in the uterus. Remove the white rod while holding the inserter tube stationary. Then very gently and carefully, push on the inserter tube until you feel a slight resistance. This ensures the arms of the IUD are as high as possible in the uterus. Slowly withdraw the inserter tube and gently remove the tenaculum. Using high-level disinfected or sterile Mayo scissors, cut the strings at 3 centimeters from the cervical opening. Alternatively, the IUD strings can be tucked into the posterior fornix. Examine the cervix. If there is bleeding at the tenaculum puncture sites, place a cotton swab over the bleeding and apply pressure for 30 to 60 seconds. Now you may remove the speculum.
How are you feeling?
I am doing okay.
You did very well. You can stay here and rest for a little while. Turn on your side if you like. There is no hurry.
Let the client rest for as long as she needs, usually 5 to 10 minutes. Place all the used instruments in a 0.5% chlorine solution for 10 minutes. Dispose of a contaminated waste. Remove gloves by turning them inside out and discard in a leak-proof container or plastic bag. Wash your hands thoroughly. Finally, document the details of the procedure, including the length of the strings, in the client record.